A very good morning to all of you. Today we will discuss with an important topic in biochemistry, that is eicosanoids. This one is short note for UG student and also a very important question for postgraduate student in biochemistry. These eicosanoids include prostanoids, then leucotrienes and lipoxenes. These compounds are derived from a 20 carbon compound arachidonic acid, which acts as a precursor for all these compounds. Arachidonic acid. This one is a polyunsaturated fatty acid. It one is a 20 carbon compound with 4 double bonds. These prostanoids includes prostaglandins, then prostacyclin and thromboxane. Well, there are number of leukotrienes from A to F, leukotrienes A, B, C, D, E, F and lipoxenes. These are inflammatory mediators. There are number of functions of these prostaglandins and related compound in our body, including bronchoconstriction, bronchodilation, vasoconstriction, vasodilation, constriction of an myometrium. Then they are responsible for platelet aggregation, responsible for inhibition of platelet aggregation. They are responsible for pain, fever and inflammation. So they are regarded as local hormones and they are very potent in their action. Coming to the synthesis of eicosanoids or prostaglandins and related compound, initially they were isolated from the prostatic secretion. That's why the name is given prostaglandins. But later on it is found that they were present or they are present in all cells of the body. So coming to the prostaglandins, there are near about 9 classes of prostaglandins from A to I. Prostaglandin A to prostaglandin I. And there are few important prostaglandin we are going to discuss, that is prostaglandin I2. This is also known as prostacyclin. These all prostaglandins and related compounds or eicosanoids, they are 20 carbon compound. They have cyclopentane ring with 2 side chain. One is with 7 carbon and another with 8 carbon. They contain cyclopentane ring with 2 side chain, one with 7 carbon and carboxyl group and another with 8 carbon. So prostacyclin is a compound. There is 2 ring, there is extra ring in the prostacyclin, that's why it is known as prostacyclin, the name is given. While another important prostaglandins are PGE2, then prostaglandin D2, prostaglandin F2 alpha, prostaglandin I2, then thromboxane, it is important. It contains oxane ring. So these are biologically important prostaglandins, and we will discuss about the leukoid synthesis and functions of leukotrienes also. So the precursor for all prostaglandins and related compound or precursor for eicosanoid is arachidonic acid. We get this arachidonic acid from the biological membrane. We know this one is the biological membrane. This one is a bilipid layer in the biological membrane, composed mainly of phospholipid, and main phospholipid in biological membrane is the phosphatidylcholine or lecithin. By the action of, suppose this one is the phospholipid phosphatidylcholine, by the action of phospholipase A2, this phospholipid get converted into arachidonic acid and lysopap, that is platelet activating factor, which on the next reaction it is converted into platelet activating factor, and there are number of actions they are carried out by the platelet activating factor. They are responsible for platelet aggregation. They are mediator in chemotaxis and inflammatory reaction. So the arachidonic acid, by the degradation of this phospholipid, it is converted into by the action of phospholipase A2, phospholipids are converted into arachidonic acid and lysopar. This arachidonic acid undergoes two important pathways, that is cyclooxygenase pathway and lipooxygenase pathway. Via the cyclooxygenase pathway, this one is the important target for the NSAID, non-steroidal anti-inflammatory drugs. For example, paracetamol, aspirin, ibuprofen, diclofenac. These all drugs act on cyclooxygenase. They inhibit both COX-1 and COX-2, cyclooxygenase 1 and 2. There are two types of cyclooxygenase, which are, first one is the constitutive type of cyclooxygenase, that is COX-1, which is inhibited by the near about all NSAIDs. And there are special drugs that they are known as COXIB. These COXIB group of the drugs act on the COX-2, which is a inducible enzyme. It get induced whenever there is inflammation, and it is inhibited by the COXIB type of the drug. COXIB type of the drugs. And this phospholipase A2, it is inhibited by the steroids. So this is the mechanism of action of steroid drugs, and this is the mechanism of action of NSAID. They inhibit cyclooxygenase, steroid inhibit phospholipase A2. And there is inhibition of prostaglandin, leukotrienes and lipoxin synthesis by the action of steroid and NSAID. So through this cyclooxygenase pathway, there is synthesis of intermediate prostaglandins, that is P prostaglandin G2 and prostaglandin H2. This prostaglandin H2, it get converted into thromboxane A2. With the help of thromboxane A2 synthase, it get converted into thromboxane. And there are various functions of thromboxane. Now remember the mnemonic here. It is very, very important. Those who contain X and alpha, there is cross here. Those who contain X and alpha, they are responsible for bronchoconstriction. Okay, and also vasoconstriction. There is X that denotes bronchoconstriction and vasoconstriction. So thromboxane A2, it is responsible for the contraction of smooth muscles or vasoconstriction. And another important function of this thromboxane, it is specially produced by the platelet, that it is responsible for aggregation of platelet. This A2 represents the aggregation of platelet. Actually, these two represent the number of double bond, but remember this as a mnemonic. This X represent the constriction and A2 represent the aggregation of platelets. So these two are important functions carried out by the thromboxane. Then this PGH2, again it get converted into prostaglandin I2, that is prostacyclin. Now remember this I2, I represent the inhibition of platelet aggregation. Inhibition of platelet aggregation, and it causes vasodilation. So these are the two important functions carried out by the PGI2 or prostacyclin. The next compound is PGE2. This E represents, it is analgesic. Analgesic means it is responsible for the pain. Then next one is the PGD2. This D represents the dilation. So this is responsible for the vasodilation. PGD2. Next one is the prostaglandin F2 alpha. As we already discussed, this alpha represents the constriction. So these are responsible for vasoconstriction. They are responsible for aggregation of platelet aggregation, and they are also responsible for the myometrial contraction of uterus. So they are helpful in the induction of labor or termination of pregnancy, PGF2 alpha. So these are the important functions carried out by these different prostaglandins. First one is the thromboxane. It is responsible for aggregation of platelet and vasoconstriction, which is not good for the heart. It is not good for the heart. That is vasoconstriction and aggregation of the platelet. PGI2 or prostacyclin inhibits the platelet aggregation and responsible for the vasodilation. PGE2, E represents the LGC. It is responsible for the pain. PGD2 responsible for vasodilation. PGF2 alpha, vasoconstriction, platelet aggregation and contraction of the myometrium. That is, it is used in the induction of the labor and termination of pregnancy. Coming to the next pathway, that is the lipooxygenase pathway. By going through this pathway, with the action of 12 lipooxygenase, it gives 12 HETE, which is an inflammatory mediator. Then with the action of 15 lipooxygenase and 5 lipooxygenase, it gives lipoxin. Lipoxins, these are mediators in the inflammation, and they have immunoregulatory action. Then with the help of 5 lipooxygenase, they get converted into leukotrienes A4, which get immediately converted into leukotriene B4. Then this A get converted into leukotriene C4, leukotriene D4, leukotriene E4, and leukotriene F4. So these are the leukotrienes which get synthesized with the help of 5 lipooxygenase pathway, and they are responsible for the bronchoconstriction. So they are responsible for the asthma. So they are the main function of these. They are responsible for the bronchoconstriction, and they are responsible for vasodilation in all body except myocardial muscles or myocardium. They are responsible for bronchoconstriction, hence they are responsible for the asthma, and they are responsible for the vasodilation except the coronary arteries. In coronary arteries, they are responsible for the vasoconstriction. So they are inflammatory mediator responsible for the asthma, and these are the leukotrienes. They get secreted in the anaphylactic reactions. So summarizing the actions of prostaglandins and related compounds are eicosanoids. The first one is the thromboxane. It is responsible for the platelet aggregation and vasoconstriction. Then PGI2 has exactly opposite action to that of thromboxane. It is responsible for vasodilation and inhibit aggregation of platelet. Then PGE2, it is responsible for the pain, or it is LGC. Then PGD2 causes vasodilation. Then PGF2 alpha, it is responsible for bronchoconstriction. Myometrial contraction and vasoconstriction. And leukotrienes, they are responsible for the bronchial asthma. They causes bronchoconstriction, vasodilation, vasoconstriction, in coronary circulation, and lipoxenes, these are inflammatory mediators and has immunoregulatory action. This is all about prostaglandins and related compounds. Thank you all of you. Thank you very much. If you like the video, please hit the like button and subscribe to the channel. Thank you.